Tell me what's going on, Brittany.
I have really tight traps. I was doing some upper body yesterday, and now my traps are killing me. They feel so tight, and my lats as well.
Okay, let's get in there and fix it with some active release technique in Graston.
Perfect.
We're going to do some active release technique on your traps, on your levator. Get in there and break up some of the tissue. I'm going to get in on your scalenes as well, okay? This is your SCM muscle. All right, so we're going to get into your traps. We're going to do some active release technique.
Okay.
You're going to shorten the muscle, and now you're going to lengthen it by going to this side. I'm going to hold down that tissue. There you go. And you might even feel it all the way through there.
Mm-hmm.
Good. Go to this side. I always talk about active release technique as a whole system. There's over 500 different maneuvers to break up all tight muscles, ligaments, tendons, and fascia. There you go. Good. And there you go. And go to the other side one more time. And now to this side. And it's always good to hold it for 3 to 4 seconds just to really allow for a deeper stretch of breaking up a fascia. And now go to this side. There you go. Good, go as far as you can. There you go.
That feels tight.
Yeah, definitely. Give me 2 more. Actually, give me 3 more. I'm going to hold it a little bit more. Yeah, you probably feel that in there. You might even feel it all the way up through there. Sometimes people feel it all the way up through there.
Yeah.
Yeah, all the way up through there. There's just referral patterns, myofascial referral patterns. Good. Give me 2 more. Okay, I'm going to hold it. You're going to go to the other side as far as you can. Blow your breath out. Good. Turn to the side. Turn to this side. Good, as far as you can. Keep it going. Good. Turn to this side. But a lot of times, you're going to turn to the side. When people do stretches on their own, they think that's enough, but a lot of times you need a little bit more leverage to get in there. So what I'm going to have you do is, I'm going to have you turn to this side without my hand, and now turn to this side. Could you feel the difference when I do it, or when you do it with me holding the tissue down?
Oh, absolutely.
Against some resistance, breaking.
It's so much harder.
Yep, breaking up some of that tissue in there. Good. And now go to this side. As far as you can. Good. Try to do the other 3 without me even giving you any assistance. Okay, I'm going to hold the tissue down. Good. I'm giving you a lot on that, though. I'm sure you can feel that. Blow it out, blow it out, blow it out, blow it out. Good. Give me 1 more. Blow your breath out. Good. Keep going, keep going, keep going. Good. Why don't you move that around, see how that feels.
Yeah, that feels a lot better.
Do you know about this?
Scraping tool.
Yeah. You're going to know a lot about it in a minute.
Oh, yeah.
We're going to use the Graston tool on you to really get into some of this tissue. Okay? And it has an edge on there so that we can break up some of these adhesions. How are we doing in there?
Yeah, it feels good.
All right. When I do Graston technique to patients, what happens is there's bleeding underneath the skin. As a result of the bleeding, your body's going to produce histamine, which in turn is going to have the body produce collagen so that you heal on your own. Why don't you move that around, see how that feels.
Yeah, it definitely feels looser. Able to move it further.
I think the right side definitely felt tighter.
Yeah.
Great. There we go. We're getting into your mid trap and the lower trap over there. We're just using a smaller blade over here. Right there. Good. You got 3 seconds. 3, 2, 1. All right, Brittany.
Yeah, I definitely feel like I have more range of motion. Everything feels looser, and the tension in my neck feels a lot better.
Sweet.
Okay.
You got it. Thank you so much for watching. Please make sure to like, comment, and share this video with someone who's suffering with neck pain.